Let us start today's session. So, happy Holi to everybody. I hope you enjoyed the festival. Let us start with some questions. So, there was a question, there was an interesting question. I'll discuss the case later. There was an interesting question about the fear that if the patient has fear in the dark, or if the patient has fear with anxiety, or the patient has fear. So, the answer would be that always try to define the fear. It is very important to define the fear and the cause of fear. If you get the cause of fear, then the treatment, then the what do you call finding the simillimum becomes easy. Otherwise, generalized fear a lot of people have because of some or the other reason. Because, for example, fear of failure, you have, maybe you had some incidents in the past where you had failed, so that always keeps haunting you. Fear of disease, because you have seen a lot of persons in your family die because of disease. So this fear is very common. Always try to define the fear, then take the rubric. Otherwise, fear soric rubric, if it's a soric rubric, it's not necessary that you take the rubric for prescription unless it is very important and it is basically very relevant to the case. That is important. So make sure that you classify fear. So I welcome hello Dr. Jadhav, Dr. Meera, Amit, Dr. Cherapullai. I hope. Namaste, Dr. Smith. Hello, Dr. Bavel. Now there was a case. There was a case where I would discuss that type of fear, that a patient had a typical fear. He was suffering from anxiety neurosis. He had a lot of fear, a lot of asthmatic problem, lot of breathing problem, and he had a very typical symptom. That whenever the fear used to come in its peak, the syphilitic part, he used to feel suffocated. He feel that he could not breathe because of fear. Now that becomes a very, very interesting and important symptom to prescribe in relation to fear. The patient has so much fear that he feels suffocated. And I gave a single dose of Spongia 1M, and the patient came out very beautifully with Spongia 1M single dose. So this is how you have to define the fear and then prescribe. That is my experience of treating fear. Now, for example, if you take fear, the patient has, for example, the patient comes and tell that they have fear of going to the dentist, what will happen, or fear going to doctors. See, these are important symptoms, and there are remedies also in the Mater Medica, but I have not found useful in my practice. For example, there was a patient who had a lot of fear in going to a dentist. So there are remedies like pulsatilla, there are remedies like carcinosin, which I have used. It did not act properly because maybe that was a psoric symptom and it was not defining the whole totality. It was defining only that particular part of the patient. In homeopathy, totality is important. No, that's why it is so important to define the fear, and if that fear becomes syphilitic, and that fear becomes the prescribing symptom of the patient's totality. For example, there are patients who have fear, okay, what will happen to me, what will, if I get cancer, if I get heart disease. There are remedies like Kalicarb is there, phosphorus is there, Spongia, pulsatilla, phosphoric acid, argentum, calcarea, lots of remedies are there. But again, if you have that past history of he has seen some family members suffering from the disease, that's why he always has that fear impeding disease. Important symptom, but you have to think twice before taking this for prescription. Okay. So I welcome Dr. Sadhna, Dr. Nitin, Dr. Kapre, Dr. Sachdeva, Meera. Again, thank you so much. My mother's trembling after COVID is much better. She is able to write now. Also, there is improvement in her grip. Oh, wow. That is a very good symptom. That's a very good news, because I also have come to know from you, Dr. Meera. So homeopathy is working. That is very important, that our family members, they should feel happy and they should feel cured, because treating a family member is sometimes a big problem, because we are so much attached emotionally. We sometimes fail to understand which symptom to take and which symptom not to take for prescription. That's why always remember the aphorism number 6, the unprejudiced observer. Okay. Please put a light on the genius epidemicus of Buforana. So before that, let me take one question. It has come on the Skype. He has written, sir, having a one patient of age 44 years of age, pain in all joints from 4 to 5 years, including the small joints. Actually, he told me started getting pain since 5 years back. That means before the pain, he got chikungunya, and after that, he's basically complaining of pain, and his uric acid is high. up to 8. So see, basically, if the patient is suffering from pain, and if he has told you, especially after chikungunya, so there is a very important rubric, or you can take symptom in our practice, that is rheumatic pain after inflammatory disease. After inflammation, the symptom starts, the disease starts. Take that symptom. For example, we have remedies. Of course, there are very common remedies which I will not discuss. I'll discuss some remedies which are very, very important and have given me good results. Lachesis, phosphorus, rhododendron, sulfur. In acute, there are lots and lots of medicine, but these 4-5 remedies have given me good results in post chikungunya or inflammatory fever. After fever, there is pain in the joints, it has not gone. In those cases, these drugs works wonderfully. Of course, the whole case is important to understand what to prescribe at that time. Okay. Yes. Assalamu alaikum, Dr. Sartaj. Now, see, basically what happens, don't ask anybody to basically have that genius epidemics of a remedy, Just see, just understand the remedy, how it comes in front of you. That is important, because once I tell you some theme, like theme of calcarea is like this, and theme of this is like this, then whatever comes in front of you, you always keep thinking about that theme, and you fail to appreciate the other symptoms of the remedy, which are also important in that case. Because in theme, sometimes see some peculiar symptoms sometimes are left out. So my suggestion would be, for example, buforana. Now, buforana is basically the poison of toad, and if it's a poison, it basically has to have a toxic symptom, and this remedy has the toxic symptoms on the nervous system and the genital organ. Simple as that. Now, what does it do in the genital system? If it is intoxicating them, or it is having toxic symptoms in the mind, the first symptom that you should remember is idiocy, childish, feeble-minded. That is buforana. It basically poisons the mind and the sexual symptom. Your mind is poisoned. The first symptom of poisoning of mind is idiocy or childish, moral deprivation, feeble-minded, fear of strangers, fear of animals. These basically are symptoms of buforana. And in syphilitic, these toxicity of the nervous system, as we say in symptom, it increases, and the patient has some syphilitic symptom, that is inclination to bite. Very deceitful. Inclination to bite is again a very, very important symptom of buforana. Now, if you go to see buforana, it basically causes the whole swelling of the body. And that's why a good remedy for obesity, which is secondary to this toxic symptoms. First, more important symptom in buforana, for example, if I tell you, is basically, if you understand buforana in case of extremities, trembling of the limbs, staggering gait. Now, the limbs become very stiff in buforana. That is very important in buforana, because most of the time you can think about remedies like causticum and rustox and maxphos, but when these remedies does not give results, think about the remedy buforana. There is stiffness. The limbs become stiff, as we say, lakdi ke saman ho jate hai wo, and staggering gait. There is a lot of cramp. There is a lot of trembling. That is also buforana. Again, a very toxic. It basically causes the toxicity of the nervous system and the male sexuals. What happens in male sexuals? A buforana patient always, I have seen in my practice, disposition to handle the organs. Disposition to handle the organs, or you can say disposition to masturbation. And as you know, the importance of disposition in a practice, as written by Dr. Hahnemann in Organon, the importance of disposition. Two dispositions of buforana you must remember, and that is disposition to masturbation and disposition to handle the organs. Sometimes what happens, the patient in the OPD is doing that part, and we say it's okay, he has got itching, he has got some sensation, he has maybe the innerwear is tight, or it is heat, or it is not like that. If he is a buforana patient, there is always a disposition to handle the organ. So these two symptoms of buforana in relation to the nervous system and relation to the mind is so important, and that is how you have to basically understand buforana. And if I go one step further, In Bufforana, always think about some bad inheritance. Bad inheritance. It is a remedy for depravities due to bad inheritance. This is very, very important. And if you got a bad inheritance of mentally or physically, everything it's in your DNA code, it keeps changing. That is Bufforana. Welcome, Spiritual Homeopathy, Dr. Sangma, Dr. Vishaka. One question, Assalamu alaikum. Last exposure to dust cold. Least exposure to dust cold causes blockage of nose on examination, nasal polyp. Patient 50 years is non-diabetic, non-hypertensive. Now, see, again, this symptom will come to you very, very quite often in your practice. If you go symptom-wise, that aggravation from dust, patient aggravation from dust and polyp, you will be always very inclined to give some medicines which have got these type of symptoms. But I've always told you, look at a broader aspect. Take the rubric sensitiveness of the patient in general. Mind sensitive, body sensitive, and we have to have a remedy which is sensitive to something. So if the mind is sensitive, if there is sensitive mind, the body will become sensitive. So you have to think about remedies in those terms. So I'll give you both the answers. First, I'll give you a constitutional effect where the body is sensitive, maybe to dust, maybe to light, maybe to air, maybe to the noise, maybe to perfume, smell, anything. That sensitiveness has to be taken care of. So we have remedies like Naxomica, Staphylococcus, phosphorus, natromure, theridion, sulfur, chinars. Okay, now this is a part where I always believe this in curing symptoms of the patient, because this is constitution. We have some remedies which basically are very specific to the nose and they're very sensitive. You can think of remedies like arsenic album, coccus cacti, sabadilla, rumex, senega, taraxicum, very sensitive to air, and then polyps develop. So this is the two parts. But for me, if I want to prescribe, I'll definitely take the first one, the generalized sensitiveness of the patient rather than the particular sensitivity of the nose. I hope I could answer the question. Cherapullai, sir, burning sensation in the tips of right and left leg, toe, and last fingers. Personality, sulfur with high BP and high cholesterol. See, tips of right and left toe. Now, this is a very, very what you call particular symptom, of a particular part. And if you're prescribing on only this symptom, sometimes it would happen that you will sometimes not get the results. But still, if you have asked me the question, I'll again give you the answer. Do think about two remedies which are very, very important. And sulfur is not that. The first remedy to think about is muriatic acid. Muriatic acid. Second remedy, think about arsenic album. And then I would say the remedies which are very rarely prescribed. Third is oleander, and fourth is miserinum. I hope you understand that. So these are the four remedies that you should look about. First is muriatic acid and arsenic, very particular. Do think about after that oleander and miserinum. That is also very important given in a practice. As muriatic acid has come to I'll tell few symptoms of muriatic acid, adapted to person with black hair, black eyes, and dark complexion. Always look for muriatic acid this way. How will you look at that? Sometimes what happens that we only look at one symptom of muriatic acid, that is great debility and the lower jaw hangs down, the patient slides in the bed. Okay, that is there. But this is very important, Then you see the patients adapted to dark hair, dark eyes, dark complexion, very irritable, very peevish, disposed to anger and chagrin, restlessness and vertigo. These 4 or 5 symptoms of muriatic acid are so important. Irritable, peevish, disposed to anger. What I'm telling you, disposed to anger and disposed to chagrin. Very close to Naxomica. That's why I'm dealing muriatic acid. You know why? Because sometimes Naxomica fails. The patient improves very slightly or patient improves partially. Then we start increasing the potency. Naxomica 200, 1M, 10M, 50M, CM. It does not work because the patient is muriatic acid, very similar to Naxomica, disposed to anger. Have you ever heard about of muriatic acid disposed to anger? That is the beauty of understanding Mater Medica, So do think about muriatic acid when naxomica, that disposition to anger is there. Okay. 13 years about increasing height after knee operation. Previously he was thin and now after able to. Yeah. So you have to take Dr. Avni in this case that after operation, the patient suddenly developed these type of symptoms. Now you have to understand after operation what has happened, what has changed mentally, physically, anesthesia was used, which medicine was used. So basically you have to basically what you have to do, you have to think about the case in totality. After operation, how did that affect the mind of the patient? That's why the whole constitution has become sick. So in this case, that is important. Thank you. Beautiful explanation. Covered everything needed. Thank you. Okay. Thank you. Sir, I had a patient in my OPD last week who had been advised ring pessary by the gynecologist. She came to me saying it occurred only after second dose of COVID vaccination. How can homeopathy help? So if the patient has nowadays, everybody will get so many patients, after effects of vaccination, after effect of COVID. And if you ask me, I have been getting so many cases of hypercholesteremia. So many cases means cholesterol at the age of 30, 35, the patient cholesterol is 400, 500, triglycerides is 800, 900, and the patient has no symptom, only dyspnea. And when you take the history, there is nothing in the history. Patient does not eat so much food. He does so much of junk food or non-veg. He's doing exercise, yoga, but because of COVID, after vaccination, developed a lot of symptoms. So in this case, what happens that I basically, as I have given you the nosode of COVID-19, I first give as an intercurrent or to open the block of the patient. And immediately after about 10 days, I tell the patient to check the reports, how he's feeling. I have seen very fantastic results with the COVID-19 nosode. If by chance it does not work, then in such case, always take the whole case and then proceed for a prescription. Of course, then you have remedies where elements from vaccinations are there. Thuja is there, Melendrinum is there, Vaccinum is there. But of late, I'm using Vaccinum COVID-19 vaccine. Before that, I was using a generalized remedy for a vaccine, that was Vaccinum. But if after COVID infection, the patient suffered from secondary symptoms of COVID-19, I normally get very good results or most of the results with my COVID-19 nosode. You can also try in your practice and see how does it work in 10 days. Go for the examination, go for the blood test and see how the patient reacts. If it does not, then you can basically take the whole case and prescribe. Sir, after surgery, wound not healing. Yeah, this is a very common symptom, that after surgery, the wound does not heal. Now, in this case, it is very important to understand that the patient basically went for surgery. Which type of surgery? Was the anesthesia given too much, or what had happened? That is important for us. So do remember this type of cases where the wound does not heal after surgery. Now you can take 2 or 3 permutation combination in this case. For example, you can take chronic effects of injury. Chronic effects of injury, like we have remedies like arnica, we have remedies like arnica or badiaga or hypericum or natrum sulf. One step further, if it does not work, then we have remedies like Belisper, Calendula, Hipersulf and sulfur, or against Staphylococcus also. But in some cases that also does not work. In some cases that does not work. In those cases, do think about myristica and gunpowder. Could it be uterine prolapse? Yeah, uterine prolapse. First of all, one thing, Dr. Sarma, that you have to always remember in these type of cases, that the patient has to do physiotherapy also. If the patient does physiotherapy with our medicine in case of uterine prolapse, we have very good results and the results are pretty fast. So tell the patient basically to do physiotherapy exercise, and with that start homeopathy treatment, where you have to think about remedies which have relaxed muscle fibers, laxation of muscles. In this case, it works very well. So it is definitely curable. Make sure that the patient does some exercise. That is also important. Okay. should a patient go for a surgery in anorectal fistula grade 3? Of course, it is very easy to say that no, you should not go for the operation, and it is very much treatable and curable with homeopathy. Of course, I have a lot of cases where the patient have been cured, but there are some cases, where the patient came very late after a lot of treatment, a lot of antibiotics, and a lot of other treatments. He came to me, he was better, he was much better, but he got superadded infection with some bacteria, and the whole area had swelled up. The patient could not move also. In those cases, in those cases, sometimes I have seen in my case also the patient had to be operated. So in this case, it is very important that the hygiene is important. I have learned from that hygiene is important. The patient has to keep that part absolutely dry, keep washing with hot water and not antiseptic like other antiseptic we use. Keep it dry, keep washing with hot water, and appropriate homeopathy medicines. In this case, you can also give some medicines which does not cause inflammation or does not cause secondary infection like calendula also. In acute cases, repetition dose, then added with a chronic remedy, it will work very nice. Remedy for what? Prolapse of rectum in ulcerative colitis patient. Yeah, prolapse of rectum in ulcerative colitis patient. You know what happens in case of ulcerative colitis? The name itself, there is a lot of bleeding. And because of that, because of recurrent going for stool, taking a recurrent steroids, mesacholamine, lot of medicine, the patient becomes very much weak and debilitated, and the whole muscles, the whole tissue become relaxed. So it is very important in this case, exercise and then treating with some medicines which is absolutely constitutional. Make sure that the muscles basically have given the constitutional medicine, then it works very fast. Of course, there are some acute medicines where the muscles have become very lax and very weak. So in these cases, sometimes I do give LM potency in repetitions. For example, think about China, think about ferrum, think about one remedy you can write down, Cuprum aceticum, and think about China. In this case, repetition in LM potency will sometimes solve the acute case of prolapse, and then you can take the whole case and cure the prolapse condition. Remedy for uterine prolapse. Now, see, first of all, see, you can take a specific remedy for uterine prolapse, or you can take uterine prolapse as basically symptom of generalized muscle weakness and all, But if you have asked me the remedy, you can write the remedy. In homeopathy, uterine prolapse has very good results. One remedy that I have used in my practice and have got good results, and that is podophyllum. Do think about podophyllum in case of uterine prolapse, also in case of rectal prolapse of piles. I have got fantastic results. Podophyllum in LM potency repetition. I have used one rare remedy again in case of prolapse, and that has given me very good results. That is, yes, I'm not getting the remedy's name. I'll tell you the remedy when it comes to me. I have used remedies like Ruta. I have used remedies like Thalaspi. I have used remedies like Trillium. I have used remedies like Fraxinus in uterine prolapse. And in rectal prolapse, podophyllum is there, Ruta is there. Again, Ruta is a very important remedy. Then I use Belisper and the injury remedies, that Belisper and all. But one rare remedy which I am not getting that name, which is a very useful remedy. In most of the cases, in some cases also, I have got very good results with Naxomica and Hyoscyamus also. So there is a wide variety of complaints, remedies that you have to think. But again, in prolapse, LM potency in repetition is very important. And the rare remedy that which I was talking about, again, you write down the name of the remedy, that is Tila. P-T-I-L-I-A. Tila Europea. That has given me very good results. Of course, then you can think about Platinia, Sepia, Calcari, Aurum, Borax, Natrum Phos, Lilium Tig, lots of remedies. But Tilia is a remedy which has given me good results in repetition dose. Of course, always follow up with the constitutional medicine. That's important. Remedies for patient 16 is suffering from renal stone, creatinine raised 2.1, urea 70, urine. Dr. Navjot, see, one thing is very important. if the patient is suffering from renal stone and the creatinine is 2.1, make sure, remember this, please everybody listen, make sure your case taking is good, prescribe the remedy. If it does not work for us in a month, it does not come out, it does not break in the USG, please tell the patient to operate. Because if you take a long time and the creatine starts increasing to 4 and 5, the patient lands up in CKD, and then if we go for the operation, the stone comes out, but the patient lands up in chronic kidney disease, and that will be because that you have not advised the patient or you have not given a correct advice to the patient when to operate. It is no harm in telling the patient that we have given the remedy, it has not worked, but go for the operation. Otherwise, if the creatinine increases, if the creatinine increases, you are spoiling the life of the patient. You are making the life hell. So there is no ego problem, or you might have removed 99 cases of stone, but don't give a guarantee that stone can be removed, and ask the patient if the creatinine is not coming down, go for the operation. The obstructing factor will be removed, the creatinine comes to normal, the patient is healthy, then you can prescribe the medicine so that the tendency of formation of stone is taken care of. Okay. I hope I have been very clear in answering that question. Next question. So let us go to the next question. Now, if I can answer the question in more detail, something about prolapse, No, see, you cannot treat creatine or stone. You are treating the patient, Creatine is the effect because the stone is blocking the nephrons, and that's because of the blockage, the creatine is increased. Once a nephron dies, we have trillions of nephrons, it cannot regenerate, medically speaking. That means you are basically leading the patient to chronic kidney disease where the nephrons have been lost and very difficult to get it back. Okay. We have to treat the personal as a whole. Whole person has to be treated. That is very important. Okay, the whole case taking is important because once the creatine started increasing, that means the body's defense has been gone. The patient is in syphilitic state. It is and there are no specific medicines for creatine. Of course, you must have heard, you must have seen in social medias or on WhatsApp, there is a fantastic remedy called L serum, EEELS here, and people say it has a beautiful results. Of course, it has got beautiful results, but it is not a specific to treat creatine. You can start that. But the obstructing factor stone, if it is not taken care of, the patient lands up in CKD. That means you have spoiled the life of the patient. Okay, so take a consultation treatment for it. Myasthenia gravis, yes, I think I told you this answer before also. I have few patients, but there was one patient basically who has got tremendous results, who has got a fantastic result with our treatment. And I told you also that I'll share the video of the case, but the patient is actually from Bhopal. He has not shown me now. He is always on the phone. So whenever the patient comes back, I'll ask him and then show you the video, and then we can discuss the case. Myasthenia gravis, how did I prescribe the remedy? Of course, in that case, I have given LM potency in repetition. I think I have given till LM 8 or 9. It was twice a day, every day. In 9, and now in 6, she is much better now. So I have done it, I think, alternate days, but I repeated in LM potency. So one more case, sir, eczema of palms with cracks. Now we have done this, cracks of palms and soles. There are lots of remedies. And see, first of all, you take care where you prescribe sometimes the common remedies. You have eczemas of the palm. So the first remedy that should come to your mind is, of course, petroleum is there, cystiscan is there, mercury is there. So these are very common remedies, and there are lots of the remedies. For example, that cracks on the soles of feet. Again, there are other lot. These remedies can be used, and of course, we can add some remedies like graphitis is there, like nitric acid is there, like nitramur is there, sarsaparil is there, silicia is there. So there are a lot of remedies. Of course, I have told you only the important remedies. There are lots many of remedies depending on the how are the cracks, whether the cracks are painful, whether the cracks are bleeding, whether the cracks are more in summers and winters. So there are a lot of other things you have to ask to the patient. Sorry. Unwanted facial in female 55 years, looking male pattern, but there are patient have to cut the hair every month, diabetes, blood pressure becomes very, yeah. So see what happens in these type of cases, for me, if you tell me, basically in these cases, I have also cases, a lot of cases, but let me be very frank with you. Some cases respond very well, and some cases do not respond at all. And the only approach I take in these type of cases is case taking and constitutional treatment. So there's nothing like constitutional treatment in these type of cases. Do take the whole case, and only I can tell you the entry point of this case. In this case, what happens mentally, that during menopause or before that, the patient's desires, the patient's will have been suppressed too much. That's why the male pattern symptoms have been started in the body, and you can see facial hairs in this type of patients. LM potency with pills, Dr. Sangma. Yeah. See, have you? I don't know whether you have attended my Google Meet on LM potency. I have, whatever I have spoken about LM potency, I am very happy with that, and I had spoken in length and depth of LM potency, how it is formed, how it came into existence, how it has to be used, what is told by Hahnemann, what is told by different scientists. So if you have that YouTube video I had done on Hahnemann Jayanti only, that YouTube, I think YouTube live or Facebook live. So, and this is YouTube live. So this is there on my YouTube live. It is about 2 or 3 episodes I did it. It's a very exhaustive lecture, and you do think, or you do hear this. It's a very interesting topic. I am very happy that I delivered such a beautiful lecture, because I have explained everything. To answer you in short, I use LM potency only in water, as told by Dr. Hahnemann, because the previous dose or the present dose should be a bit higher than the previous. That is the philosophy. So if you prescribe LM3 twice a day, the philosophy of LM potency has been lost. No. So how can you get results? When we think of LM potency, and sir, when we think of LM and when we think of CH, no. Whenever see LM potency, do again go to my YouTube live, and LM potency I have explained in detail. If you have read Hahnemann's Organon of Medicine, when Hahnemann sir wrote about the 6th edition of Organon, he had written that whatever I have told before this is nil and voided. Now this is actually the new method of prescribing. So if you are basically following the 6th edition of Organon, that means you have to give all patients the LM potency. Why? Because aggravation is minimum or not there, repetition you can do, and the results are fast without any aggravation. The answer is that in short. गुरुदेव, स्टमक में घबराहट रही है, teeth yellow and lower jaw, no pus, no looseness in teeth, but bitterness of tongue. Chili patient. धन्यवाद अनुपम कुमार. घबराहट होती है पेट में. नाउ सी व्हाट हैपेंस इन दिस टाइप ऑफ केसेस. हम ये बोलते हैं कि बेसिकली जब हमको पेट के अंदर घबराहट होती है, जब पेट के अंदर एंग्जाइटी होती है, मतलब जो भी कुछ होता है पेट में होता है, और फिर दांत खराब हो रहे हैं, एक्सवाइजेड जो आपने सिम्टम बोले हैं, डिके ऑफ टीथ एंड ऑल. सो ये आपने 2 प्रकार के सिम्टम पूछे. सो हमने एक देखा है तो एक ही प्रकार का केस है. सो अगर हम इसको रेपिटाइज करते हैं, इसको हम रेपिटाइज करते हैं, सो 2-3 चीज ध्यान रखना बहुत जरूरी है. हम जब भी हमको लगता है कि पेशेंट को घबराहट पेट में होती है और नेक्स्ट सिम्टम आपका कि दांत खराब हो गए, 3-4 दवाई जो मेरे दिमाग में रेपिटाइजेशन चल रहा है अभी, और 3-4 दवाई जो मेरे दिमाग में तुरंत आ रही है, अगर दोनों हम चीज़ को हम रेपिटाइज करें, फर्स्ट इज आर्सेनिक एल्बम, सेकंड इज बेलेडोना, थर्ड इज बोरैक्स, फोर्थ इज कैलकेरिया कार्ब, कैलकेरिया फॉस एंड कार्बोवेज। ये रेमेडीज मेरे दिमाग में आ रही है। जब हम दोनों चीज़ को रेपिटाइज करके देखते हैं, एंग्जाइटी इन स्टमक एंड डीके ऑफ टीथ, येलोनेस, नो पस, आर्सेनिक, बेलेडोना, बोरैक्स, कैलकेरिया कार्ब, कैलकेरिया फॉस, कार्बोवेज एंड चामोमिल ऑल्सो कैन कम। सो आई होप आपको समझा अनुपम जी। खुद रेपिटाइज कीजिए। और आपका पेशेंट चिली है, सो ये तो बहुत अच्छी बात होगी। अगर आपका पेशेंट चिली है तो सभी हॉट मेडिसिन निकल गई। सो अगर आप देखेंगे जो मैंने आपको रेमेडीज बताई है वो भी पूरी चिली है। आर्सेनिक भी चिली, बेलोडोना भी चिली, कैलकेरिया कार्ब भी चिली, कैलकेरिया फॉस भी चिली, कार्बोवेज भी चिली और चामोमिला भी चिली। सो बिल्कुल सही बैठता है। ये 5 ड्रग्स में से आपके पास आएंगे और इसमें से और कुछ सिम्टम देखिए और प्रिस्क्राइब कीजिए, शायद आपको फर्क पड़ जाएगा तब पेशेंट को। सर गिव एक्सपीरियंस ऑन ट्रीटिंग sciatica with remedy compliance because there are cases with failure, kindly guide. Now see, sciatica, first of all, again I would like to tell you that sciatica sometimes becomes very, very depressive in treatment. It does not get cured. Of course it does get relief. Now the first remedy that you have to think, there are a lot of remedies, like we have colocin, we have naphyllum, we have guaiacum, we have rustox, we have phytolica, lots and lots of remedies. Now let us first understand one remedy. For example, there are a lot of in fact I'll tell myself that first when we were basically in practice at and we could not get results. So one remedy that we used to prescribe, and that was very common, and that was colocin. That was colocin. And in colocin there are few symptoms which are very, very important. The first symptom of colocin that you have to remember, and I think everybody remembers that, the shooting pain. Colocin is a very, very important remedy for shooting pain, and the patient of sciatica of colocin will tell you this symptom very, very precisely. वो आके बोलेंगे डॉक्टर साहब ऐसा लगता है कि पूरी इसी करंट साउंड जा रहा है, बिजली खिंच दौड़ती है वैसा, शूटिंग पेन, लाइटनिंग शॉक्स, होल लिम्ब, स्पेशली लेफ्ट साइड, लेफ्ट हिप, लेफ्ट थाई, लेफ्ट नी और पूरे पॉप्यूटल फोसा तक। मतलब वो शुरू होगा हिप से, तो लेफ्ट हिप, लेफ्ट थाई, लेफ्ट नी और लेफ्ट पॉप्यूटल फोसा तक पूरा। और उसके साथ में क्रैम्प्स, हिप्स में इतना क्रैम्प्स आता है, द हिप्स आर सो मच क्रैम्प्स, उसको लगता है एज इट इज स्क्रूड बाय वाइस, इट इज स्क्रूड बाय वाइसेस। And this type of patient will always sleep on the affected side. Affect जहां तकलीफ हो रही है वहीं जाकर सोएगा. That is a sciatica of colocin. As you go further, अभी हम देखेंगे कि by chance, for example, sciatica of phytolica. चलिए तो phytolica. In phytolica, it is again electric shock like pain, but the difference is flying pain. Flying pain like electric shock, rapidly shifting. Now, whenever the patient comes and tells you rapidly shifting, immediately one remedy comes to your mind is pulsatilla, and we prescribe pulsatilla and it fails. Rapidly shifting, remember pulsatilla, and there's one more remedy, and that is Lacam. So phytolica, rapidly shifting, worse from motion and aggravated at night. This is a very, very important symptom of phytolica. In this way, as see, there are a lot of remedies and there are a lot of mathematics can be talked about that. But this is how you have to enter, and this is how you have to differentiate your whole mathematica in type of pain. Don't jump into the remedies, because once you start jumping into the remedies, only 2-3 remedies will come into play. For example, as you go further, and for example, sciatica pain. Now there is one more remedy called McFoss. Now McFoss, everybody knows how it is McFoss pain. Next remedy comes Rustox, and in fact, if you say Rustox, Rust ox has a typical pain. Rust ox has a typical pain, and rust ox elements from sprain of single part muscle or tendon. Lying on damp ground aggravates, that is rust ox. So these are 4 remedies, whatever came to my mind, symptomatically I'm telling you. Let's go further. Hyperacidity, GERD, headache, sometimes headache, heaviness from death, no weakness in the body. Yes, so हमने जो आपको आंसर दिया उसी पे हम कॉन्सेंट्रेट करेंगे डॉक्टर साहब। ये आप रेमेडीज पहले एक बार पढ़ लीजिए। ये 5 जो रेमेडीज मैं आपको बताइए, चिली रेमेडीज ही है। आपके सिम्टम में मैं और एक रेमेडी ऐड कर देता हूँ, और वो है काली कार्ब। ये इसमें काली कार्ब भी आ सकता है। रम्बलिंग इन स्टमक, स्वेटिंग फ्रॉम पेन, सोल्स आर्मपिट इन एवरी पोजीशन। अच्छा, ये अगर आपका आ गया तो उसमें और 2 दवाई मैं ऐड कर दूंगा इसके अंदर। आपको देखना पड़ेगा फॉस्फोरस, और आपको देखना पड़ेगा सिलिशिया भी उसके अंदर, और दोनों चिली है, दोनों चिली रेमेडीज है ये भी। For median nerve also, yeah. So if there is a problem in the median nerve, do think about the remedies for which are basically, see, normally median nerve, if it affects the patient has the habit of sitting on the on a sofa and then pressing that nerve, so that in that case, median nerves get damaged very fast, and in that also nerve like pain, shooting like pain, radiating pain, these remedies will often get repeated. So I think it's a good job to understand the remedies first, 5-6 remedies, and see the type of pain, and then you'll be able to prescribe. Dr. Viveka, hello doctor, for female 51 years cannot stand or walk with sensation of falling or being pushed forward. No vertigo, lower limbs are aching, period stopped 2 years back, please say. So there is a sensation of falling. There is a sensation of falling. मुझे लग रहा है, I feel that my head is spinning. I feel that somebody is coming. I feel that somebody is hitting. So now I would tell you, I'll give this in two answers and 2 things. Sensation of falling. Now an implied rubric that is knocking to my mind means, if a person is having symptom of sensation of falling, that means he is on the edge where he feels कि as if his esteem, उसकी इज्जत खराब हो सकती है। मैं गिर तो नहीं जाऊंगा, मेरी इज्जत खराब तो नहीं हो जाएंगी, कोई मुझे बोलेगा तो नहीं, मेरे को कोई ये तो ह्यूमिलिएशन, sensation of falling, sensation of being humiliated, sensation of being hurt, sensation of the esteem going down, इस symptom के वजह से on the background the patient has a sensation of falling. This is more important rather than prescribing on the exact symptom of sensation of falling. I have got good results when I have used this sensation of falling in relation to mind rather than in relation to the body. I hope you understand. Everybody has to understand what I have been doing in my practice and getting results. Of course, sensation of falling, you can take remedies like ammonium mure is there, Endroctonus is there, Apis mellifica is there, Causticum is there, Cimex is also there. But it may only give you a partial results. Make sure that basically it improves as a whole. In that type, take this sensation of mind of humiliation or esteem or anything which is hurting the patient. One more question, okay? So how next, any other question? Yes, so one more question. Kindly get treatment in goiter and different remedies with it comparison. Okay, now see, goiter, of course, see, I think I have told one of the case of goiter I had discussed basically. Goiter, now see, if you just want some remedies for goiter, there are lots and lots of remedies for goiter. Now take my opinion of goiter, how I am getting results. Sometimes what happens in case of goiter, you have to take symptoms which are very, very particular of that part. How I tell you. One patient comes to me and say, Doctor Sahib, I have got this goiter and I feel whenever I am eating, drinking or like that also, no, there is a lot of choking. There is a lot of choking. I have to take my saliva or liquid like that. A lot of choking. So this symptom is basically describing the miasm on that area. So we have remedies. I have told you one remedy, suffocative remedy, spongia. One remedy is also which has given me good results. Once one spongia fails is graphitis. I'll give you one more example. The patient comes and tells you there is a lot of constriction in the throat, and because of that constriction, the first of all, how will the patient tell you that? That's what I'm telling you. ऐसे लग रहा है कुछ दबा रहा है, somebody is कुछ दबा रहा है मुझे मेरे गले में, और मेरा पैसेज नैरो हो गया है और चिपक रहा है. This is important, how the patient tells you. And whenever this constriction word comes, then patient tells, do think about remedies. The very, very important remedy which has given me so many good results only with this symptom of constriction with goiter, and that is Crotalus cascavella. Crotalus cascavella, very, very good results. And of course, do think about spongia also and Lycopodium also. Okay, so Crotalus cascavella, spongia and Lycopodium. Of course, there are other combinations also we'll give you further, but this is how you have to enter the case. Despite good living conditions, young patient dissatisfied with life, longs for wealth, works and studies hard, doesn't reach the goal fast enough, gets very desperate and impatient. Now, the answer is with you only. Sometimes what happens, you have everything in life, but still you want something which you're not getting, and because of this, you become impatient. Impatient remedies. Impatient remedies are so important, in this case, because in spite of having everything, you have to think about remedies. First, chamomilla. Second, naxomica. Third, sepia. Fourth, sulfur. Jaw shrinking and bitter tongue always. Acidity, thirst, chill. Then naxomica. I have whatever remedy I have told you, Dr. Sahab, Anupam ji, वो सब chill remedies ही है. वो सब chill remedies ही है. Naxomica or see, then you have to basically then relate that particular symptom to mind, no? Then it becomes the whole totality of the case. Child patient repeats her symptom frequently again and again. Great anxiety rubric. There is one rubric, if you want to know the rubric, that the patient repeats the sentence first. I think the remedy in that case is zinc. Child of 6 years age doesn't speak a single word. How much we try, he doesn't speak, cries always time, wants to, hides himself in the arms of his. You can take the two types of rubric, gestures and antics, Dr. Alam. And if you see the patient, if it's not speaking, there is no other treatment except taking the whole case. Or he's hiding, he's playing antics, gestures. You can take those rubrics and enter the case with the history of the pregnancy of mother. Patient 20 years, lean, thin, color, complexion, whitish, menstrual history, regular, skinny, non-specific modalities. Yeah, you can think about same remedies, like you can think about sickle cord, you can think about pulsatilla, you can think about sabina, and you can think about thuja. He speaks on phone, he sees cartoon, he speaks that time, but he didn't speak anything when someone says something. Yeah. So we have basically we are looking at a child who is very timid that way. So I think a lot of questions and answers have been done. It's already 1 hour. So I hope you enjoyed this session as much as I enjoyed teaching you. If you have some questions still unanswered, I'll basically try to answer on the WhatsApp. Thank you for joining. I have a webinar just after 5 minutes. So thank you for joining. Thank you everybody for joining.